All right, we'll get started. So date, and these meetings are going to start morphing because number one, we don't have the turnout we had been having on the front end of all this, but it is. Yep. Thank you. So there, and things are changing a little bit, right? We're not in the crisis that we had been a month or so ago. And it could actually, this format could potentially be used for staff meetings, whether it's a Nat or Karen or other managers or directors could utilize the same format for a staff meeting kind of format. But for now, what we'll do today, we'll just do a quick update on the COVID stuff. So we'll start with the rapid testing. So I know we've talked about this over the past few weeks. The rapid testing kits that we get are roughly 45 kits a week. We are not getting through the week with the 45 kits that we're given. We're running short. So far, the past 2 weeks, we've come up short on Wednesday before we get our delivery on Thursday. So as of this morning, we just got our 45 kits yesterday. As of this morning, we had already blown through 7 of them and only had 38 kits left as of this morning. So I'm sure at the pace that we're going, we're going to be out of kits again before our next delivery, which is next Thursday afternoon. So just something to be mindful of. Typically, those tests are being used for patients who are being screened to go to a nursing home and need a negative before they can go, or patients who are being admitted and who are symptomatic, and we're trying to identify whether or not they really have COVID or if they can go to Watkins 2 as an example. There's been a little bit of a morphing of that as well. There, some of the doctors are doing some different things with those kits. So we're going through them faster than we have enough supply to support. So we just got to be mindful of how we're using them. And I know some of the docs are not trusting the rapid test kit results, so then they're duplicating and doing the PCR testing, which is taking 2 to 3 days to get back in some cases, especially going over the weekends. So we just got to be mindful of how we're using them. So just as you're on the floors, be thinking about that if you're hearing docs that are going to repeat testing and we don't really have a good understanding as to why. It would be a good question to ask them before they run that second test. Or in some cases, third test, because that's happened too. So that's an update on that. The PPE usage, we are actually in a really good place. The one thing we will ask is that on the gowns, there have been some issues that seemed to kind of pop up last week with disposable gowns all of a sudden getting used more than we had been using actually during our spike a month or so ago, to the tune of like 300 almost disposable gowns more than we were using when we had the spike going on. So what it appears to be is that we're just not utilizing the reusable gowns as much as we can and should. We have, as of yesterday, Bridget was getting 350 reusable gowns for the Hayward campus. So we need to make sure we're using those up first before we start tapping into the disposable gowns, because of course the disposable gowns, it's one and done and it's gone. So we're trying to preserve those as best we can, which is why we have the reusable. So going into this long holiday weekend, I would say if you're working the floors, be mindful of that. If you run out of gowns on the floor, check with the supervisor and see if they have the reusable gowns left downstairs. And Dana and I were talking earlier also about making sure that this afternoon they supply them to the floor before the day is out. So you should check your floor supplies first. If you don't have any on the floor, then reach out to the supervisor. They will find what we have left for reusables. And if those are used up, then they'll get you the disposables. But we just need to be mindful of how we're using it. Did you want to add to that, Dana?
No, I sent that email off to Bridget to see if she could bring some more up to you, Annette and Karen, for the weekend, and then at least leave one bag in the supervisor's office. But I have not heard back from her yet. So.
And ladies, I was just explaining to the Watkins 2 sitting here with me just that I've spoke with Mike in Materials Management. He's going to make some extra space down below all the PPE on Watkins 2. That's where it will be. And then we've already started to stock those there. So we should be good at Watkins 2. And
Annette, maybe put a note at the station or something, or stations, so that people remember to go check there first before they're calling and getting disposables sent up. I would say do that for 1 and 2 if Karen is on the line. All right, anything else on that? PPE, we're good? Okay. On to the volume of COVID patients we have. So a week or so ago, we were seeing a little bit of an uptick. That uptick has kind of sustained itself this week. We are averaging what seems to be about 8 to 10 for the most part, either a combination of positives and or rule outs on the floor. We've had days when it's been a little more than that. We've had some additional patients over and above that who are pending testing results and ruling out, things like that. We're not alone in that. There are other facilities in the area. So for the nursing homes, Quabbin Valley actually did have a couple of tests come back positive yesterday. They had none up to this point. So they actually had 2 positives hit Quabbin Valley. That's important for us because what will happen most likely is they will stop taking patients in that facility until they get that cleared up, just like the others have done. So just something to be aware of and mindful of. If it's their own patients, they're more likely to take them back if we had their patients here, but if it's a new patient going there, they are much more likely not to take those patients. So it's just something to be aware of, that they are now seeing positives over there as well. I can tell you that Ballinville Nursing Home and Wachusett are in a better place than they were, but they are still not entirely opened up for admissions either. So there's barriers all over the place to getting patients back into those facilities or to those facilities to begin with because of those issues. And they have to take guidance from the state as to when they can reopen. So there's lots going on at the state level around the nursing homes and trying to get them clean enough, essentially, to take patients back again. And they have specific parameters they have to meet. So that's kind of going on along with this volume issue as well. We also have, as of Monday this week, the direction from the state around reopening the state. And in this conversation, we're specifically talking about reopening the hospital and what can we do in phase 1 and all the steps that we have to take. So there's an attestation form that has literally pages worth of things that we need to comply with to make and attest to that we are doing before we can officially be in the phase 1 state. So we're in good shape there. We have all those things in place, and Rosanna's department is the one mostly impacted by this because, of course, that's talking about reopening at least urgent cases to the OR, which in some respect we were doing anyway because there were some that were lingering that needed to be addressed. But Rosanna, do you want to speak to some of that?
Sure. So as Nora said, the attestation is in process right now. Once we submit the attestation to the state, we will officially be allowed to enter phase 1. And in phase 1, we'll be able to perform urgent procedures for conditions that, if left untreated, would lead to high risk or significant worsening of the patient's condition. That's their definition of urgent procedures. And it is based on providers' clinical judgment. This is a little bit different from what we were already doing. We were doing emergent and urgent procedures all along. The ones we were doing were performed, were selected based on criteria that if we were not to perform a procedure, there would be a risk to a patient losing a life or a limb. So it was pretty stringent. Right now, we're opening it up a little bit more. So, for example, patients who have a family history of colon cancers or have had lots of polyps are now going to be able to come in and have their colonoscopy, or patients that have positive Cologuard or things like that. But we will not be able to do screening colonoscopies. So if you're a patient that has had heartburn that was causing you discomfort and distress since March, you haven't been able to get your EGD done, and now you'll be able to. We're also allowing some pain procedures. And again, while we have to definitely be very careful and make sure that we're opening up our perioperative services safely, and we are very cognizant of PPE. Thankfully, the hospital has enough, and we want to make sure that we keep our staff as well as patients who come into the hospital safe. To that effect, we are not allowing any visitors unless there's an extenuating circumstance. The traffic through surgical services is limited, and we will be monitoring very strictly. We will limit use of the waiting room. So you will see in a couple of weeks or in a week, there will be a podium outside next to the kiosk as you enter, the food kiosk, and there will be a representative from surgical services standing there with a schedule and screening patients and signing them in there, so that if somebody is here early for their surgery, or if surgeon is running behind, they will be asked to wait in the car or outside of the hospital so as not to create unnecessary traffic inside the hospital, because we want to, again, keep all of you safe, keep other patients safe by minimizing the traffic. What else? Some other surgeries that we'll be able to hopefully resume is more orthopedic cases, they specifically DPH defined outlined orthopedic procedures that will be performed for significant functional impairment as something that we can now do in phase 1. And that includes a lot of our patients that have been waiting since March for their procedures. We are not going to be doing total joints, purely elective ones or bariatric surgery in phase 1. That will be closer to phase 2. And if all goes well in phase 1, it is predicted to last about 3 weeks. Then hopefully by the end of June or middle of June, we'll be able to start performing some bariatric and total joint surgery that will really help us for the entire hospital to get those patients back in.
Mm-hmm. So what's important about that is that, of course, as we start doing some of those cases, some of them may get admitted. So we just need to be mindful of that. There are requirements that we have based on the guidelines from the DPH that we have to have a certain amount of capacity still within our system, which would include, in this case, beds at Athol. So we just have to make sure we have a minimum of 20% of our beds combined available for patients to stay in phase 1. If we drop below the 20% bed availability, we then have to notify the state and tell them that we're not meeting that threshold, and they may pull back on phase 1 and surgeries and all these other things. So it's very important that we push patients through the system, get them discharged, like all these other things to keep that bed availability open so we can continue to do surgeries. It's like this all tied together, right? So we just need to be mindful of all that. In addition to that, the ICU has to maintain a 25% capacity at all times. And if we drop below that, we have to notify the state as well. So there's specific parameters that we have to stay within to stay in phase 1. And if we don't, they may pull back on us. So just things to be aware of. Some other things that we have to open back up under this phase 1 is the mental health unit. So we are in the process of notifying the physician and the staff today that we expect them back as of Tuesday. We're not going to reopen it over the weekend or on the holiday. We will reopen it on Tuesday. There is an increase in the volume for psych patients in the ED that we've noticed this week, and we're having longer wait times to get them placed to other facilities, which we had not been experiencing until this week. So we are in the process of getting that set back up for reopen on Tuesday. Additionally, we're also doing some reopening of some services in the HAMG practices. So Andy Pattison and his team have been working on plans to get that going. You're also going to see a tent, if you haven't already seen it, a tent out behind the annex. We're going to start doing community testing. That will also start next week. And there will be communication coming out about that, I believe, next Tuesday as to how that will work. But that's another piece of what we're doing. So there's bottom line is lots of going on in the background to get us in compliance with the attestation that we have to submit, which we will submit next Tuesday. So we will officially be in phase 1 of our reopen at that point. I can tell you that Wynn notified me yesterday that as of yesterday, only 6 other hospitals have signed off on their attestations in the state. So we're right there in the thick of it with everybody else, and we're not behind the 8 ball by any stretch of the imagination. So 6 hospitals in the state is a fraction of the number of hospitals there are. So we'll be in a good place come Tuesday, and we'll be able to reopen some of those services. Okay, so any questions on any of that? No, okay. So in the midst of all this, as we all know, and we talked about a little bit last week, we have the Meditech update coming. There is a training set up next Tuesday that myself and Dana will be essentially facilitating with our consultants from Santa Rosa who are working with us on the Meditech project to get our nursing staff and departments back up on either online and practicing in the system or back in the system and using it, because we have to do some testing in that system come the end of June. So we need some practice time before that. So that's going to be happening Tuesday. There will be additional training sessions for those staff. They will eventually become our train the trainers. Essentially, they'll be the super users on the floors, and we may end up adding people to that group over time. But this is the group we're going to start with come Tuesday. But there's lots more coming on that, and all of a sudden you're going to start seeing a whole lot more information coming out on that. We're trying to get it set up so that there will be terminals on the computers that those that are the super users can access, so that they can get into the system and show all of you, if you're not a super user currently, what it's going to look like, kind of start getting you exposed to it, get a feel for what it looks like. It's truly not overwhelming. It's very intuitive once you're in the system. It's not terrible. So we want to get people exposed though sooner than later, so that when we go live in February of 2021, we'll all be in a better place. So there'll be more coming up on that. We also have had some conversations over the past week or two, unrelated to the attestation, but more related to the number of nursing students and other student requests we are having for students to come back into the organization to do their clinical rotations. And Dana and I have been talking more recently about opening up CPR classes, ACLS classes, and the like. So Dana, do you want to speak to that a little bit?
Yep, so we actually did start and did a very slow opening of Skills Day yesterday at Athol. Not yesterday, I'm sorry, Tuesday or Wednesday, which went very well. We made sure that there was less than 10 people in the room. We used the big conference room over there. And actually what we did was we gelled everybody in when they walked in the door. They had to sit in a chair 6 feet apart. And Paulette and I either under the room and did the station for them, and then had each person come up one at a time. This coming week, we have a ACLS certification, which is about 4 hours, about 6 people in that class, PALS class on Friday, and then I think we even have a CPR class. So we will be starting to slowly open things. It's going to look different. You'll obviously still need to wear masks. We're going to make sure you have gel available. We'll be cleaning the equipment in between. But just kind of be looking for that. And you may be asked, if you're not due for something right now, to be pushed out a little bit so that we can accommodate that 120-day period that American Heart has given us.
Questions on any of that? I will tell you on the student side, remembering these are like your Mount Wachusett students, the Pittsburgh State, all these other schools that we work with. We are likely going to set up a meeting with some of these schools and HR to come up with some alternatives to see if we can keep students out of the building as much as possible, but still help get them through some clinical rotations, and see if we can't come up with a hybrid, essentially, of minimize the hands-on clinical within the building, and then a combination of that with some kind of virtual setup with the staff that might be precepting them. Hey, Bob. So there'll be more to come on that. We haven't had that meeting yet. We just talked about that on senior team this morning. So once we get a little bit further down that path, we will have more to come. Right now, the plan is not to bring students back in until September, unless we can come up with another plan that will still help support them, but keep us protected as well, and not, burn through PPE and all these other things that we have to keep, as precious as possible and protected. So more to come on that. Any questions on any of that? No? Okay.
Well, that was good.
Are you trying to purchase these things to get ahead of it?
PPE, yes.
Yes.
Oh yeah, yeah. We've been working on that now for well over a month, and Dana can probably speak to that better than I can. She's been working with Scott more closely. We actually have a fairly good supply right now, but as soon as you introduce students into the equation, Bob, we're
Right.
going to burn through things a lot faster. So we're trying not to bring them in and have them in situations where we would have to utilize more PPE, potentially taking it away from our own staff if we end up in another crisis. So yes, like Scott's got, hands out all over the place looking for more PPE, everything from masks, gowns, gloves, everything. So
Okay.
yeah, for sure.
Laura, as part of this phase 1 attestation, you have to have, how much on hand? Is it 14 days?
14-day minimum supply, yep, and we're beyond that. We have at least a 15-day supply with our current burn rate, yep. So we're in good shape. We shouldn't be, and Scott's anticipating shipments to continue to come. Some of them come, some don't, but for the most part, we've been getting what we've been ordering. So we're in a better place than we were, say, a month ago, for sure, absolutely, yep. All right, any other questions around that? All right, so then we started to talk about the format for this call. So we were in some calls, some of us earlier this week, around you either love Zoom or you don't. How has it helped the organization? How has it not? This is one of those things I think actually it's helped us from a staff meeting kind of perspective. And not that I would want to entirely get rid of face-to-face and and we're not even able to go back to that yet, but this is kind of a nice venue, and it allows more people to be participative without having to be in the building if people don't want to come in. So I foresee us kind of evolving, whether it's this particular meeting or other staff meetings within your departments, and utilizing this format in addition to people being face-to-face with whoever the department lead is or whoever's running the meeting. So putting that out there, we may also for this particular meeting, because things have settled down a little bit, we may shift this to an every other week meeting in hopes that we get better, better attendance at every other week meetings versus the weekly. We had a great turnout on the first couple of meetings, and things have definitely slid off a little bit. So I don't want to waste people's time with it. If they find it valuable, that's wonderful. I understand that some people are actually looking for the recordings. That's great if they're accessing it after the fact. But I just want to make sure that if we're having it, I'm bringing something of value to you. So we may be looking at shifting this to every other week. As we start to get on the other side of this, there's less to share, right? At this point, it's about reopening things, and absolutely we'll share that kind of information. But the list of things we had at one time to share has started to dwindle a little bit. So are there thoughts about that?
So from the Walk-ins 2 room here, I'm hearing Carol behind me saying the reason why she's never able to attend the staff meetings is because she can't get in on her time off. So she would greatly appreciate this sort of Zoom environment. In the past, we have done phone calls, and Heather can attest to this. Like into the staff meetings, kind of conference calls, and it's not as very well received because you can't see the other people on the other end. And sometimes I know those phone calls get very choppy because I've been on them myself, those conference calls. You really don't get all the information. So I think the Zoom is definitely beneficial to us in the future.
Yeah. I think it's pretty sure it's here to stay. It's not going anywhere. It's just how we're going to use it moving forward. So, and I would encourage it. If you haven't already set your staff meetings up that way, Annette and others, then I would say maybe this is the time to start doing it. All right. Does anyone have anything else they want to share? Have questions about, thoughts, concerns?
Dana, were you going to chat about where to find the this recording? Because Carol said she also looked for it and she was unable to find it.
Yep, when you go to the intranet page, you want to go under departments, and you want to go to Patient Care Services, which is PCS. And right at the top of the screen, the Community Relations has made a tab that says COVID-19 updates. So all of the pre-recorded ones are located there.
Okay.
Thank you.
You're welcome.
Does anyone have anything else? Other than this is Bob's last probably official
I'm
meeting.
gonna miss these conferences. I thought these were good when they first started, and they are beneficial.
Yeah,
So I think you get more across doing it this way
yeah.
than the other way. So I like it this way. I
Okay.
can't do it, but I like it.
Well, that's good feedback though, Bob. I appreciate that.
Go to other people's offices and listen. That's why I'm up here.
He walked by and said bye to me, but I said, don't you want to join us? He's like, no.
I didn't know this was it. So
Yeah. Well, I appreciate the feedback, Bob. I think
We're
this
going to
is
miss you, buddy.
enjoy your career in Hayward Hospital. That's all I can say. Did me wonders.
Well, thank you for your time and your service, mister. It's been great.
Just keep it open. That's all you got to do.
Yep, that's the
That's
plan.
the plan.
Yeah, we're gonna have you come back as a safety specialist. So.
I heard something this
You
morning.
come stock the precaution cards.
Yes, you did, Bob, and we need to chat because I would like to keep you per diem for mental health.
I can't make any money on retirement until I'm 66 in 2 months.
When is that?
Next year.
Oh, for Pete's sake. All right, get back in as a safety specialist, and then we'll put you per diem.
I can do sitting and make nothing, but
Better than nothing.
I'll let you know in October. I gotta
Yes.
do some things.
Okay.
All right, but it was good
All right.
working with everybody.
Yeah. Been lucky to have you,
Highlight of
Bob.
the day is seeing the people that work here. The work. It used to be easier being a nurse. It's not anymore.
No.
So thanks
and you-
for everything.
Yep, thanks, Bob.
You betcha. Bye, everybody.
All right, I think we're all set, folks.
Yeah, thanks, Bob.
All right.
Thank you.
Thank you.
Yeah, oh, wait.
Thanks, everyone. Happy Memorial Day weekend.
Yes,
Oh, good luck, Bob. That's what Kara's.
from Kara, yep.
Kara Butler?
Kara Belmonte?
That was probably Kara in the ICU.
Oh, Kara.
Probably Kara in the ICU.
Oh, okay. Good luck, Bob.
Thank
All right, thanks, everybody.
Bye.
Just like
Have a good one.
days.
I know.
Oh,